you can have short-term and long-term complications. Short-term complications, the most common is hypoglycemia, which is a decrease in the sugars in the body. What are the symptoms that you will recognize, that you have to recognize in case you have decreased sugars? So they are lethargy, you have palpitation, increased sweating. So immediate first aid will be, if suppose it is in the office or at home, immediately it will be, the first thing, if the patient is conscious, administer oral fluids with glucose, increase sugars. And if suppose he is not responding, or if he is not getting better, immediately rush to the hospital, because earlier the treatment, the patient recovers better. Long-term complications. These long-term complications, they do not occur in a span of 1 or 2 years. They take around more than 10 years. It is over years that these complications come into place. So the complications will be stroke. You can have blindness. The person can have blindness or a difficulty in vision. He can have a heart attack. He can have numbness and tingling in the toes and feet and hands. So these are all the complications, long-term complications. Now, what can you do for that? So you can do certain things wherein you can control diabetes, or you can at least not get it. So those will be basically in our hands. Lifestyle modifications, which include proper exercise and healthy eating habits. So healthy eating habits means you reduce your sugars in the food, reduce the starch, increase the fiber content and the protein content. So with regard to diabetes mellitus, early screening does play a very good important role in the progress of the disease. So what do you mean by early screening? So screening is usually for certain persons like age more than 45 years, and if suppose your BMI is more than 25, and if you are a woman who has had gestational diabetes mellitus during pregnancy. So before concluding, I would like to mention something about a status called pre-diabetic status. So pre-diabetic status is the state, it is a state of the body before diabetes sets into. So this actually doesn't have any symptoms, no symptoms at all. The blood test can be the fasting and the HbA1c, through which you will be able to know whether you are a pre-diabetic or not a diabetic. So it is a very important stage, because at this stage, if suppose lifestyle modifications like diet and exercise can be followed very, very strictly, the diabetes can be prolonged. You will get diabetes at a later stage, or you might not even get diabetes. So that is why it is more important. Thank you.